healing the mind, restoring the heart. Psychology in the light of truth.
Hello, my name is Ladies Ferran and I'm a psychology student from Florida International University. Welcome to this podcast. This is the episode number 1 in my 4-part series of children's mental disorders. In this episode number 1, I would love to put the focus on attention deficit hyperactivity disorder, also known as ADHD. This episode is purely informational. Here I will explain what ADHD is, why it is important to understand the meaning of ADHD, and the way this mental illness affects the child. ADHD is one of the most frequently diagnosed neurodevelopmental disorders in childhood because of the frequency with which we see it in schools, homes, and in clinical settings. Parents, teachers, and professionals need to have clarity about what ADHD really is and what it is not. It is important to understand ADHD because it directly affects the behavior, emotions, and relationships of future generations, the child. The children with ADHD in many occasions are misunderstood. They tend to be labeled as lazy, disruptive, or unmotivated, when the truth is that they are dealing with brain-based differences that affect attention and self-control. Understanding ADHD is helpful because it reduces the stigma and allows the adult to respond by supporting the child and not with punishment. When ADHD is recognized appropriately and treated correctly, children are more likely to succeed emotionally, academically, and socially. This topic has a relevant interest to me because in my job as a teacher, I see the way that ADHD affects my students in a school setting. The teacher works with many students who do not have the ability to concentrate, sit still, or simply follow instructions. Learning about the ADHD helps people, caregivers, and educators to understand why the behavior is happening and how to support the children positively. According to DSM-5 here, ADHD is classified as a neurodevelopmental disorder. This means that this disorder starts in childhood and is closely related to the way that the brain develops. ADHD is described because it shows the persistent patterns of inattention, hyperactivity, and impulsiveness that interfere with the everyday brain functioning development of children who have it. The symptoms appear before the age of 12 years old, and they should be present in more than one setting, for example, the home and in school. There are 3 usual types of ADHD. The number 1 is predominantly inattentive presentation. With this one, the child struggles with focusing, organizing, and with the completion of tasks. The number 2, predominantly hyperactivity impulse presentation. With this one, the kid may be super active, impulsive, and have difficulties with sitting still. The third type of ADHD is a combined presentation. The number 3 is the most frequent among the 3 main presentations of ADHD. This one shows the symptom of inattention and hyperactivity impulsivity. The most common symptoms of ADHD are difficulty to keep the attention, being easily distracted, forgetfulness, difficulty to follow instructions, and poor organization. On the other hand, we have symptoms such as excessive movement of fidgeting, talking excessively, interrupting others, difficulty waiting for turns, and acting without thinking. That behavior should be developmentally inappropriate and cause impairment. Some of the documented causes of ADHD are causes that have a genetic factor because ADHD tends to run in families. Other factors that contributed to it are differences in the brain structure, especially in the areas that are related with the executive function and neurological difference that relate to the dopamine parental risk factors such as exposure to tobacco or alcohol, low birth weight, or premature birth. ADHD is not caused by poor parenting, sugar, or lack of discipline. The strongest treatment for ADHD is multimodal. It has more than one way of approach. The most common treatment include behavior therapy to teach self-regulation, parent training programs, classroom accommodations, and medication, acting like a stimulant or non-stimulant medication. The medication will not cure ADHD, but it helps to reduce symptoms and improve functioning when they are properly monitored. In summary, ADHD is a complex and very researched childhood disorder that affects the attention of children, behavior, and self-control. Getting a close view of ADHD and understanding it allows caregivers and professionals to support our children more effectively and compassionately.
Healing the mind,
Thank you for watching.
restoring the heart.